I was looking through some more recent work on this topic. I think this is out in May 2026. And if you're somebody who's ever been told you have arthritis in your knees, then you've probably heard something like this along the way. Um, don't wear your knee out, now. Be very careful. Stop with your squatting. Stop your training. Stop your lifting. You need to quit running because that's going to be too much impact. This knee is bone on bone. You've probably heard some iteration of that language from some sort of provider. The problem with that is that advice isn't supported at all by what we're starting to see in the research in these areas around arthritis. So there was a randomized controlled trial, very recent. I was looking at people that had been diagnosed with moderate knee osteoarthritis. So these weren't healthy people. They're not elite runners. These are people that have arthritis. So that they screened them out for that to put them into the study. And what they ended up finding was the people that they had exercised the hardest got the best overall results in the parameters they were looking at. So that's important to note. They didn't get worse, they got better when they pushed them harder. And that's something that is kind of counterintuitive to what most people have heard over the years. So they had 120 people diagnosed with knee osteoarthritis, and they were putting them into groups. They had low intensity exercise group, moderate intensity exercise group. Then they had what they called the high intensity exercise group. And then there was a control. And they did 3 sessions a week, 12 weeks. And all they did was nothing real fancy, just treadmill work or cycling work. And didn't do any magical exercises, no special corrective exercises. They were just progressively loading the system with more intensity in these different styles of training. And the first part that starts to break up this narrative is the group that worked at the highest intensity during the study was cutting their pain on average by over 50% from when they started the study. 50%. That's big when we're talking about somebody's quality of life. They were able to walk further on these time tests that they did. They had better function day to day. They were moving better. They reported less disability by the end of the study, and they did this way better than the groups that were in the low intensity exercise. And that might be surprising to a lot of you, as many times people who are told they have osteoarthritis of the knees are told to be careful, to lower the intensity, to lower the impact, to start doing pool aerobics or something along those lines. And this is where things get interesting, because that has been a big myth for a long time. And a lot of folks have heard this before, and you probably have as well, but I've been told for years that loading an arthritic knee is basically grinding the cartilage away that's left, like wearing down a tire or using sandpaper on a piece of wood, and that you only have a finite number of repetitions in that knee before it's gone. Unfortunately, that's not how living systems operate. Cartilage isn't just some analogous, like brake pad analogy. It's a living tissue, and living tissues will undergo adaptations when they're stressed. All at different rates, but that process is there. So some of the interesting things that go a little bit deeper is they were measuring biomarkers associated with the breakdown of cartilage that you typically see in people's bloodstream. These aren't perfect, but the people that trained the hardest were the ones showing the least evidence of cartilage breakdown as they continued to measure these biomarkers. they weren't showing more cartilage breakdown, they're showing less cartilage breakdown. And that information by itself is the exact opposite of what most people have been told over the years when they show up to a doctor's office with knee osteoarthritis. There were MRI findings in the study, and a lot of people are going to focus here because of what was seen, that the highest intensity group did show some small increases in cartilage thickness and cartilage volume after the 12 weeks. And it's interesting. It's absolutely interesting. The numbers on the change weren't big, but it's interesting to note that in 12 weeks that they did see some changes in cartilage thickness and cartilage volume. So interesting is the word. But it's not proof that we're regrowing cartilage in 12 weeks. The cartilage cellular turnover time can't happen that fast. Just the physiology doesn't allow for it, and the authors themselves of the paper were cautioned against using that as an interpretation from the study. That that this is an interesting finding and something to explore in the future, but 12 weeks is long enough to really see how far we can take that. Because it could just be early adaptation changes or hydration changes. So we can't get too carried away with that finding, but we need to keep an eye on it and run these things out longer. But that MRI isn't the most important finding. The most important findings are about what the people reported. And the most important findings are the people that were loading their knees more with higher intensities, had less pain, had better movement in the future, improve their day-to-day function, and were able to tolerate the increased intensity of exercise over the 12 weeks. Where people get this wrong is they think that arthritis is disabling them. And this can be true, but often it's just everything that happens after they're told they have arthritis becomes disabling. Based on what they're told, they may stop walking, stop squatting down, stop doing their exercising, stop trusting their body. And all that does is lead you to become weaker, less conditioned, more afraid of continuing to train. Then you get more sensitive, and then all we're going to do is turn around and blame the arthritis on where we're at. And this is something that the clinicians need to hear about this study, is we need to stop treating arthritic knees like they're made of glass, because it's not that, because that's exactly how you're going to end up making somebody more fearful and fragile moving forward. The solution is finding something where we can start and rebuilding tolerance to training and loading. And before you get in the comments, there's going to be people that are going to need surgery. There's going to be people that have symptoms that are so severe they're going to need some sort of intervention. And there's going to be situations where the progress is going to be slower. I get all that. But none of those things changes the larger point we're making. And the old model says load is causing damage, but the evidence is increasing in the opposite way, saying that appropriate loading drives adaptation. And those are two different conversations. So your arthritis in your knees is not any reason to stop doing any training, but it might be a really good reason to get started.